My name is Susan Simnitt, and I will be completing my baccalaureate degree in nursing in December 2018. Immediately after high school, I earned my Bachelor's of Science degree in Curriculum and Instruction from Texas A&M University. I taught fourth grade for 2 years before becoming a stay-at-home mom. When my youngest daughter was in first grade, I decided to work toward a new career. I began nursing school in 2005. I graduated from Houston Community College with my associate's degree in nursing in May 2007. After graduation, I worked at Healthbridge Pediatric Hospital, which is a small pediatric hospital in Houston, caring for children requiring rehabilitation on one wing and patients that needed respiratory support in the other wing. When I left the inpatient setting, I began working at a home health company as well as contract work doing pre-op and post-op care in the clinic setting. This gave me an opportunity to work with the adult community. In 2012, I began working as a float nurse in the clinics at Houston Methodist Hospital. In 2015, I began working contract at Texas Children's Hospital in the GI Specialty Clinic. That job eventually became permanent, and I am currently working there now. The first student outcome goal that was met in Lamar RN BSN program is practices safe and effective holistic patient-centered care to a variety of patients, families, populations, and communities in multiple settings from a global perspective by incorporating theories and evidence-based findings. This falls under the human and society construct. In the course Nursing 4540 Practice Care of Communities in the summer 2018, we researched a global health concern. This topic I researched was cholera and the factors that affected the spread of this disease. I used evidence-based practice to make recommendations on how people can make water safer to drink to prevent this illness. Another aspect of this class was to choose an aggregate in our community who may need extra help developing a disaster preparedness plan. The aggregate I chose was senior citizens that live in the 55 and older section of my neighborhood. I did a windshield assessment of the community and developed a teaching plan and recorded a video presentation presenting a disaster plan and what to do in the event of a hurricane. For the Civic Pride and Diversity Initiative assignment in Nursing 4540, I focused on home-delivered meals. This service provides hot lunches to citizens in the community that may not be able to cook for themselves. This is a program that I became involved in over 10 years ago with my daughters. I enjoy making contact with people that are homebound and touching their lives, even if it's only for a few minutes, while delivering a hot meal to them. This goal objective was met by 100%. The second goal is supports families, patients, and populations and communities in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death with dignity. This is under the Lifespan Health Continuum construct. This was accomplished in Nursing 4620, Compromise Multiple Health States, which I took in the spring of 2018. In the class, we created a PowerPoint presentation based on interviews with a patient in a compromised health state. I interviewed a 16-year-old with Crohn's disease. We discussed complications that he has experienced and the treatment that he receives. I did research on community assistance available to patients with Crohn's disease to assist in maintaining wellness and preventing exacerbations of the disease by providing nutritional information. I also provided information on support groups in the community for patients with IBD and their families, as well as a camp that is sponsored by a local hospital that is offered to teenagers with IBD. This goal was met 90%. The third goal evaluates patient-centered care for patients, families, populations, and communities across the lifespan based on common and complex health needs and compromised multiple health states when considering multiple determinants of health. This goal is also under the construct of lifespan health continuum. In Nursing 4316, Comprehensive Holistic Health Assessment, fall of 2016, we completed a focused assessments of patients using Shadow Health Assessment computer programs. This provided a virtual experience to be able to complete a simulated head-to-toe assessment. We did focused assessments in various environments. We were able to assess patients that were young children up to geriatric assessments. The patients we provided care for had different complex medical needs. This goal was met 100%. The fourth goal is synthesizes clinical judgment in nursing practice utilizing critical thinking, nursing process, research, and evidence-based practice. In Nursing 4390, Nursing Inquiry Evidence-Based Practice, which I took in the summer of 2017, we were assigned a quantitative article critique assignment. I researched and critiqued an article about thromboembolic care in the PICU. For the qualitative research article, I researched pneumonia care in the nursing home, which was qualitative descriptive study from the resident and the family member perspective. This was insightful and very applicable because my father-in-law was in a nursing home and at risk for pneumonia when I took this class. So I took a special interest in that topic. In Nursing 4316, Comprehensive Holistic Health Assessment, I used critical thinking and used nursing process to assess and intervene appropriately for a discussion post assigned regarding Brian Foster, a patient with chest pain. My knowledge on evidence-based practice and the importance of it was increased due to this class. This goal was met at 100%. The fifth goal employs safe, effective, patient-centered care using theories and evidence-based findings in collaboration with patients, clients, and members of the interprofessional and the intraprofessional healthcare team under the construct of a patient-client-centered care. In Nursing 4321, Nursing Theories and Online Education, which I took in the summer of 2016, we had a focused insight essay question in Module 3. I discussed how system theories are a way to approach the care of an individual or a group in a complete and holistic way. This allows healthcare teams to work together in a cohesive manner for the good of the patient. I discussed my work environment at the GI clinic where I currently work. I work closely with the providers as well as dietitians and speech therapists to treat patients with feeding difficulty using evidence-based theories. The sixth and seventh goal are under the construct of professional roles and conduct. The sixth student outcome goal is differentiates multiple role dimensions and practices within ethical, legal, and regulatory parameters when caring for patients, clients as a member of the interprofessional and intraprofessional healthcare team. In Nursing 4550, Nursing Practice, Leadership and Management in the Healthcare System, which I took in the fall of 2017, there was a discussion board post in Module 3 where we discussed healthcare leadership roles. In the discussion board post, I discussed staffing issues in the hospital that I had worked at, and shared that one of my co-workers had to call Safe Harbor due to the shortage of staff one time during the day shift. I used the Board of Nursing website to research this process for Safe Harbor during this assignment. The seventh goal is demonstrates professional integrity, effective communication, active inquiry, and service to the community. In Nursing 4550, Nursing Practice, Leadership and Management in the Healthcare System, we were asked to write a paper titled Effective Leadership and Qualities. In my paper, I stated that the number one trait a leader must have is professional integrity, more specifically honesty. I also stressed the importance of good communication between leaders and staff, as well as co-workers with other co-workers. In my paper, I discussed my own strengths and weaknesses as a leader. In Nursing 4550, Practice Care of Communities, I demonstrated effective communication when discussing the needs of community and developing a disaster plan. The student learning outcomes of the Lamar RN to BSN were all met by the classes that I took. Obtaining my bachelor's degree this December is a huge accomplishment and a goal that I have achieved. I not only met these specific goals from the student learning outcomes, but many others during my time at Lamar University. In the next 5 years, I would like to go back and work in the inpatient setting. I really enjoy working with pediatric patients and their families, but I may go and work with the geriatric population in the inpatient setting. Either way, I would like to get my certification in whichever field I decide to work in. I would like to also use my medical skills to volunteer and impact not only my local community, but also like to serve the communities worldwide. I went on one medical mission trip 10 years ago and would love to go on another one. I'm a youth mentor at my church, and they have a very active ministry in the mission field, and I plan on going to Kentucky this spring break with the youth group, and then later on in the year I plan on going to Brazil also with the youth group. My goal is to ultimately go on one mission trip a year.